Hey folks, welcome back. Today we're going to talk about a problem you may have never even heard of, and yet it's a problem for millions of men and women, the high tone pelvic floor. Let's get started. If you watch this channel, you know how important your pelvic floor is. It's important for bladder function, bowel control, sexual function, and prevention of pelvic organ prolapse. We spend a lot of time talking about the weak, slow pelvic floor and what you can do to fix that. But there's a group of people that probably should not be up-training the pelvic floor. That means they should not be trying to strengthen the pelvic floor. And those are people with this thing called a high-tone pelvic floor. A high-tone pelvic floor is a non-relaxing pelvic floor, a pelvic floor that stays contracted all the time. So you may be asking yourself, well, how do I know if I have a high-tone pelvic floor? Well, 1 in 10 people do. And the main symptom associated with a high-tone pelvic floor is pain. That may be vague pain that's kind of hard to localize other than the fact that it's below the belly button in the pelvis somewhere. Maybe pain with intercourse. That may be the most common symptom associated with the high-tone pelvic floor. And in particular, pain associated with any penetration, not just deep penetration, but any penetration. There are, of course, other symptoms as well, like changes in the urine stream. Perhaps you used to be able to avoid normally and have a constant urine stream that continued until you were done emptying your bladder. But now the stream is interrupted, and you may even have to bend forward and bear down and push with your abdominal muscles to help empty the bladder. You may have multiple small bowel movements during the day because the anal sphincter is not relaxing properly. You may have other bladder symptoms like urinary frequency and urgency, and you may have noticed that these symptoms tend to get worse the more core exercise you do. So you may be asking yourself, how do I know if I have a high-tone pelvic floor? Well, 1 in 10 people do. And the symptom most commonly associated with a high-tone pelvic floor is pain. Now that may be a vague lower abdominal or pelvic pain, or most commonly, pain during intercourse. Yeah, I think that's probably the most common symptom among people with a high-tone pelvic floor that we see at the Center for Pelvic Floor Medicine. But there are other symptoms as well, like a urine stream that's interrupted. Perhaps you used to be able to empty your bladder completely with a nice continuous urine stream, but now that urine stream starts and stops and you have to lean forward and push to help empty the bladder. That can be associated with a high-tone pelvic floor. Having multiple small bowel movements each day can be associated with the high-tone pelvic floor because the anal sphincter is working in coordination with the pelvic floor. And if it's not relaxing properly during a bowel movement, you may have multiple small bowel movements during the day or not be able to empty your rectum adequately. There are other bladder symptoms like having to urinate more often than usual or rush to the bathroom for fear of not making it in time. That can occur, and so can symptoms of stress incontinence, leakage with coughing, sneezing, and laughing. Believe it or not, that can happen in patients that have a high-tone pelvic floor as well. Finally, some people notice that their symptoms get worse when they do core exercise that engages the abdominal muscles in particular, because every time your core contracts, the abdominal muscles come along for the ride. And so why did you get this? Or why does anybody get a high-tone pelvic floor? We really don't know, but there are some things we know to be associated with getting a high-tone pelvic floor. And one of those things are psychological factors, carrying around a lot of psychic stress that seems to accumulate in the muscles of the pelvis. That definitely can be associated, but isn't an absolute necessity. It's just that we have noticed it more often in these patients than in patients that don't have a high-tone pelvic floor. Exercise habits as well. If you do a lot of Pilates, other core exercise, if you're a dancer, ballerinas in particular, I think, tend to have sort of super engaged core muscles all the time. They may be at greater risk for developing a high-tone pelvic floor as well. But again, you may not have any of these things. It may just be one of those things. Now, how do you diagnose this problem? The key is finding a healthcare provider that knows what it is. And believe me, most don't know what this is. And so seeing a urogynecologist may be very helpful for you. When you see a provider like a urogynecologist, what they're going to do to make the diagnosis is a pelvic exam. They're going to want to feel the resting tone of those pelvic floor muscles. Now, if you examine enough women, you know what the normal resting tone is. You know how firm those muscles should be. And if the muscles are more firm or if they're tender, that's a clue that may indicate the patient has a high tone pelvic floor. If touching those muscles elicits the same kind of pain you've been having, for instance, the same kind of pain you experienced during intercourse, again, that supports the diagnosis of a high tone pelvic floor. I've noticed over 25 years of practice now that patients with a high tone pelvic floor tend to have asymmetric pelvic floor tone, meaning one side of the pelvic floor tends to be higher tone than the other side, and the side that's higher tone tends to be the side associated with pain and tenderness. Finally, your provider may ask you to contract these muscles during the exam, and the reason they're doing this is they want to see the speed with which those muscles respond. A normal pelvic floor can contract briskly when you do a Kegel exercise, but a high tone pelvic floor, because it's already so contracted, tends to be sluggish when it contracts. It's a slow squeeze to elicit any further muscle shortening, and that's another clue that can help your doctor understand what's going on and then move on to treatment. There's a lot that can be done to improve or even totally resolve the high tone pelvic floor, and the first thing that helps people is just understanding what's going on. A lot of patients that come to the office with these pain complaints that have been seen by multiple other providers sort of feel like they're crazy by the time they show up at the Center for Pelvic Floor Medicine. They have seen providers that just don't understand the high tone pelvic floor. And so explaining that it's common, that there's treatment solutions available, can give people an immediate benefit. It's funny that if you explain what's going on to a patient, they start to get better even without doing anything else. And so that's the most important thing, just understanding you're not a crazy person and that there are good treatments available. Now, I suggest to my patients that have a high tone pelvic floor that they reduce or eliminate core exercise until the problem is resolved. Every time you engage your core muscles, the pelvic floor goes along for the ride. And what we're trying to do is to get these muscles to relax. So eliminating core exercise in the short term can be very positive. Now, pelvic floor massage, believe it or not, that's a real thing. And it works just like regular massage to help muscles that are too tense and sore as a consequence of that. The people that are specially trained in pelvic floor massage are a group of physical therapists called Women's Health Physical Therapists. Now, you can search online for one in your area. It usually takes multiple sessions, and they do it with a gloved hand inside the vagina, pressing on those muscles and applying enough traction on those muscles that they begin to release. And it can be uncomfortable. There's just no way around that, but it can be very beneficial, and sometimes you'll see your physical therapist for pelvic floor massage several times, and you'll get excellent results, and the problem will go away for months or even years, but it can come back again. But the next time it does, you'll know what it is and what to do. There are things that people do at home as well. For instance, using a somewhat firm 10-centimeter ball, like some kind of exercise ball, for instance, and lowering yourself down onto it so that it's pressing upwards on those pelvic floor muscles. And if you do that, you'll find that that also is uncomfortable because the muscles are tender. But while you can control the amount of traction if you're doing it yourself at home, and you'll find a level of discomfort that's tolerable during this maneuver. And what you would do is try your best to engage those muscles, do a Kegel exercise while there's traction on those muscles from the ball, hold it for 10 seconds, and then release and let that traction increase further. Now, you do this several times, maybe twice a day for 10 minutes twice a day. That can be of benefit as well. Now, resolving psychic stress is important, right? You're not crazy because you have this problem, but a lot of people with this problem do have a significant degree of psychic stress, and learning meditation can really be helpful. There's a whole bunch of different kinds of meditation. Transcendental meditation, I think, is very helpful, but there's a lot of other sorts of meditation. If you're interested in TM or transcendental meditation, you can go to tm.org and learn this technique, but learning how to relieve psychic stress can also help with this problem. And finally, it's clear that a lot of women that have a high-tone pelvic floor have a history of some kind of trauma, sexual trauma, but it may be any trauma that is causing them to store a lot of tension in these pelvic floor muscles. And working with a competent mental health professional can be a benefit as well. And so now you know something that most people don't. I hope this has been helpful to you. If it has been, please like this video, subscribe to our channel, leave a comment below. It's really going to help us reach more people. I appreciate your time. We'll see you soon.